welcome to my YouTube channel. My name is Debbie and I am so excited to finally be getting my YouTube channel started. This has been something I've been wanting to do for a while now, and I'm just excited that I'm finally getting the courage to branch out and put my first video online. I just want to give a little bit of background information about myself before I get into the video. I am currently a registered nurse. I graduated last December, so December of 2019, and obtained my ADN, Associate's Degree in Nursing, and I was able to sit for the NCLEX RN. I did that in January of 2020, and I passed on my first try with 86 questions and officially became a registered nurse. I accepted my first job in October and started that job January of 2020, and my specialty is the ED. So I kind of just wanted to do my video about being a new nurse, a new graduate nurse in the ED department with the pandemic. It's already hard being a graduate nurse or being a new nurse, and a specialty, especially like the ED. ED is very fast paced. So to throw a pandemic on top of that has really been a struggle. I don't think I've seen a lot of videos where a lot of the nurses are really talking about their struggles and stressors in the pandemic, going through the pandemic. So it was definitely something that I wanted to talk about. This is not only just nurses, but even our ED techs on the floor, nurses on the floor, nursing students, doctors, respiratory therapists, anybody who is involved in the care of COVID patients while in this pandemic. It is definitely a stressful time. I definitely love the hospital I'm at, and the fact that we're really a family and really helping each other get through this time. So I'm just gonna start right now about just being a new nurse in the ED. So currently being a new nurse in the ED is stressful all on its own. You're getting out of nursing school. You've never really cared for a patient without somebody by your side, and you really never you followed people in clinical, but were never really involved with having to make sure that that patient was not making a turn for the worst. And once you get on the floor and you're with your preceptors, they do start you off slow. I started off with one patient. We get 4 patients in the ED. Started off with one patient, got my comfort, but I kind of felt like they do advance you very quickly. Before you know it, I was with 2 patients, 3 patients, taking care of 4 patients, rooms being full, having 4 patients roomed at one time, having to start IVs, having to assess my patients, and then move on to the next patient, having to start an IV, assess patients, get that patient worked up, get all their labs out, anything that you have to do, taking more orders, like making sure you're pulling your meds. And I mean, at times you have 4 patients that are requiring a workup, because I am a mid shifter, and when I come in at 11, it's already busy in the ED. They're really just waiting for me to get in, and so they can open up my room. So there's usually people in the waiting room when I'm getting in. So as soon as I get in and I get on the floor and go over my rooms and open up my rooms, I'm basically getting loaded with 4 patients. And it sounds bad in the beginning. When I was on my own, it was so stressful. Like, I seriously felt like the ED was not meant for me. I was stressed all the time. I was just so ready for my shifts to be over, came home all my days off, and when it was time to go back to work, I really just did not want to go back to work. It was so stressful and so overwhelming. When I finally was on my own, it was also overwhelming just when I was with the preceptor as well. But especially being on your own, and then you throw in a pandemic where very sick patients are coming in, and you're doing things daily that you do in the ED, but you don't see daily. When I'm working in the COVID area, we're intubating almost daily. All of our patients are septic, and a sepsis bolus, our protocol is very strict and it's just so many steps that go along with septic patients, and you have to make sure that you meet a goal. And I will probably make a video that really gets in detail about sepsis. It's a process and not something that I can talk about in this video, but you have to make sure that you're meeting that goal and doing everything that you have to do for this patient, for that patient to have the best outcome. And there's so many things that can go wrong with a septic patient because they have so much going on, blood pressure issues, they're infected. I mean, it's just so much. So that on top of, I mean, in the back you got when COVID first came out, and the whole respiratory issues, CPRs, intubations, everything was told to go to the back because, and still to this day, CPRs go to the COVID area. Just because when you're working on somebody, you want to be as protected as possible, and we don't want a CPR coming in. And then we find out later that was a COVID patient, and we've all been exposed because we were not 100% gowned in the way that you're supposed to be. So a lot of the stressors come along with patient care and just knowing that you are that person in charge of that patient's life. Like, if something's going bad, it is my job as a nurse to identify that. The doctors come in, they assess the patient, they give you orders, and you are the one who's in charge of making sure that that patient stays stable. If anything you see, you're looking at their monitors, you're monitoring their vital signs, you're going in there giving meds, you're assessing your patient every time you go in there. If you see something that's just not looking right, it's your job as a nurse to not miss that and to make sure that you get that information to the doctor so the doctor can come and reassess the patient and put more orders in or let you know what's going on. So I think that was the scariest part for me, is just knowing that my knowledge or lack of was really, I mean, if I miss something, I could potentially lead to it could potentially lead to a negative outcome. Patients could code. I mean, it's just very scary when you've never really been in that position before. And, you know, being a new nurse, you feel like in nursing school, if you're making certain grades, like you just are going to come out, you're going to shine, and it's a whole different ball game when you get out into the field and you're actually working. And like I said, actually adding COVID on top of that has really been an extra stressor. It's scary. It's scary to know that you are around particular type of patients and you're sometimes all up in their face. And I come home every day and I have my mom and I have my daughter, and you know, you just really never know. It's hard. It's hard because, I mean, you can't just not come home to your family anymore for a year because you're working as a ED nurse or ED doctor or anything in the ED, a respiratory therapist. I mean, you have to take that risk, and it's a scary risk daily. And I know in the beginning it was so scary. I kind of feel a little bit more comfortable caring for COVID patients now. I have to say I happily have not gotten COVID yet or not tested positive for a COVID coronavirus as of right now. And so that is very great. That's a very good thing. Not good, but it's a very good thing because I work with COVID patients like basically daily. I'm just going to say daily during my 3 shifts a week. And I have been picking up a whole lot extra in the last month. And being in the ED way more than I used to be. I used to just do my 3 shifts because, like I said, I just really dreaded being at work. And I just know one day I came in and I think like my love for what I was doing just changed. It was weird. Like I came in, I had a sick patient. I think I actually had 2 patients that ended up going to ICU that day. And just the fact that I was able to know what to do, and I knew when this patient came in, these are the orders that I know that the doctor's gonna order. I know to go pull this particular med. I mean, it's kind of like something just kicked in and I was like, wow, like you seriously can do this. And I had not felt that way at all. Like seriously, I was questioning whether the ED was really for me. And the fact that I came to work and just felt like, wow, like you can do this. Like you knew this before anybody even gave you orders. You knew what was really going on with this patient. So that is definitely one thing I want to talk about when it's a GN. When you're a new nurse, there is a time period, and I did talk to the people who are in charge of my GN residency program about the way I was feeling, and came to find out it was very normal. A lot of new nurses feel this way, especially during their first 6 to 9 months. Between the months of 6 to 9 months, they start to feel this way. In the beginning, you're just happy, like, oh my gosh, I'm a nurse, like I finally did it. So it's a happiness. But then when you're on your own and you're having to deal with this on your own and you're the one in charge, a lot of new nurses I heard kind of go through this type of feelings that I went through, where it was like, wow, is this really for me? Did I pick the right profession? Did I come to the right specialty? Just so many things. And then to throw in the COVID on top of everything that we're dealing with is very, very scary. Being a new nurse and coming out and being exposed to this, I think, is in the long run going to make me a stronger nurse, because some of the stuff that I've seen and some of the stuff that I've had to deal with, even my preceptor was saying, like, some things you don't always get to see. And I feel like we've seen and been involved in a lot of things that you don't see daily due to the pandemic. So it definitely has, I think, made me a stronger nurse in the long run. Another thing is, coming through the pandemic, our ER never really got 100%. Our hospital hasn't really never gotten just too bad. I mean, we've had a lot of COVID patients, but nothing like a New York type COVID or other places that I've heard of. But we have had a lot of COVID patients. We've had spikes and then we went down. So our hospital hasn't been at the capacity that it normally is. And these last 3 weeks, like, our hospital has been crazy. I mean, people in the waiting room, people in hall beds, people in chair beds outside of the unit. It's just been very busy. And that is one thing about the ED. Like, you really never have time to sit down. You don't have time to take a break. You get your lunch break sometimes. That's bad to say. But the thing about the situation is, because I feel like I'm kind of starting to ramble, is being a new nurse during the COVID pandemic has been very stressful. It has been very scary. But at the end of the day, I feel like it has been very rewarding to be a registered nurse during this time. This is the year of the nurse, and it's so sad that this had to be the way our year was celebrated. But I would not choose any other profession or any other unit than the unit that I'm in right now. I love it. Like, I go to work every day and I do things that other people cannot do. Not everybody can care for life. Not everybody can keep their calm during certain situations. Not everybody can sit there and assess a patient and know that this patient is taking a turn for a worse. I mean, it definitely takes a special type of person to be able to care for other people and treat other people with kindness and still be under the stressors that they are in. And I actually had a patient tell me that yesterday, was pretty much telling me that despite everything that we go through as nurses, in the particular hospital that I'm in, he's like, I always see, when I'm here, I always see y'all smiling, laughing, you know, coming into the rooms with the patients, making them feel comfortable. But we know that y'all are in very high stressful situations, but you never let it be known. And I think that is one of the best things that you can hear from a patient, is that they are happy with the care that you give, happy with the care that the hospital that you work in gives, and just can understand that you go through things. But at the end of the day, regardless of what I'm going through as a nurse, I still have to come in and I still have to care for these patients. So that's basically, I mean, what I have to say about being a new nurse or working in the pandemic. If you have any video ideas that you want me to talk about, I just definitely drop that below and let me know if you like my video or you want to see more content from me. Subscribe to my channel or hit the subscribe button. I will be talking more about nursing, different types of things that come across in nursing and the things that I do when those situations arise. I can talk about nursing student, how to get through certain things in nursing school. I also want to kind of throw some videos out there that have to do with my ketogenic diet, hence Keto Nurse. So I will also do days in the life of RN, ED nurse, just different things like that. And thank you for tuning into my video, and I will hopefully have another video up soon.